Thank you very much. It's a privilege to be here at this conference. I know we're pressed for time, so let's get to it. Let me walk you through what I'm going to cover. I think it's important for everybody here in Israel that works in public health and is interested in tobacco to understand from a background standpoint the regulatory authorities that the U.S. Food and Drug Administration has to regulate tobacco products. We'll start there. Then we'll get in a time machine, if you will, and we will go back in time and look at what the industry knew about their business and what the tobacco industry knew about nicotine. Then we will come back to today and give you a quick overview of the public health reality and FDA's plans for regulating tobacco and nicotine going forward. But let's start with the regulatory authorities. And one of the most important things that you all need to know is the critical role that we at FDA play when it comes to regulating tobacco products, the role that we call the gatekeeper. As a gatekeeper, the scientists at our center, the policy experts, the other experts at the Center for Tobacco Products, we stand between the tobacco industry and consumers. And one of the most important gatekeeping functions that we play is to review new products and to review new claims, and it's FDA that decides whether new products and new claims can come to market, not the product developers and not the marketers at tobacco companies. So our focus is on smart regulation, where we can ensure reliability, protect public health, and instill confidence in the public in the role of FDA. A lot of lessons have been learned from the historically unregulated marketplace in the United States, products that were sold to the public without ever being reviewed, unsubstantiated claims about reduced harm, and unfortunately, young people becoming the replacement customers for addicted adult cigarette smokers who died or quit. Prior to federal regulation in the United States, companies could make basically any claims they wanted, and we saw descriptors like light and low and mild. Health-concerned smokers were misled by these claims. They were misled into thinking that these products were less harmful. Unfortunately, the research showed that was not the case. Light cigarettes did not reduce the risk of disease for developing smoking-related cancers, other diseases. Switching to light cigarettes didn't help more smokers quit and may have actually decreased motivation to quit along the way. The law that put FDA back in the business of regulating tobacco products in the United States in 2009, the Tobacco Control Act, put an end to unsubstantiated claims going directly to the market. To protect the public and to create a healthier future on a bipartisan basis, the United States Congress passed the Family Smoking Prevention and Tobacco Control Act in 2009. Ultimately, our goal is to reduce the harm associated with the use of regulated tobacco products in the United States, reducing the number of kids who start using products, encouraging more current users to quit, and reducing the adverse impact from the products for people who continue to use them. The initial grant of authority was over cigarettes, smokeless tobacco, and roll-your-own tobacco. There was this provision in the law that said through rulemaking we could deem other categories of products that meet the statutory definition of a tobacco product to be within FDA's regulatory reach. And that's what we did last year in what we called the deeming rule. And all the products that you see listed on this slide are now within FDA's regulatory reach, and we are regulating them. At a very high level, let me tell you what this regulation consists of. And when we think of, well, what is a properly regulated marketplace, the next few slides will give you a picture of what we mean when we say a properly regulated marketplace. Pre-market review of new products and new claims. Mandatory post-marketing surveillance. Product standards, that's the authority to ban or limit the allowable levels of ingredients, compounds, constituents in the finished product. Mandatory testing and reporting of ingredients, adverse reaction reporting, the authority to do new warning labels, restrictions on advertising and promotion, and the authority to collect user fees. Our program is entirely funded by law by industry user fees. A market share assessment is made on different categories of tobacco products every year. The law says what our budget is supposed to be in every given year, and the industry pays. These are not taxpayer dollars. Here's how we use this authority in this regulated marketplace: to better understand the products, to restrict product changes in order to protect public health, to prohibit health claims that state or imply a reduction in risk or a reduction in harm, restrictions on marketing and distribution, using that product standard authority to decrease the harms from tobacco products. We have a major enforcement and compliance program underway. Regulations are only as good as the ability that a government has to enforce them, and we have a very aggressive approach to compliance and enforcement. We also take our public education responsibilities very seriously, whether it's educating the public about the regulatory actions that the agency is taking, or making a major investment in public education efforts to prevent kids from ever starting and encouraging adults to quit. All of this based on a large investment in regulatory science. Specific provisions under the law are designed to protect kids and to restrict youth access to all tobacco products. A minimum age of sale of 18, a mandatory photo ID check for anybody under the age of 27, a ban on vending machine sales unless the vending machine is in an adult-only establishment, some kind of outlet where kids have no access whatsoever, and a ban on free samples with some limited exceptions. And we're doing all of this under a population-level public health standard. This is not the old safety and efficacy standard that's used to regulate drugs and medical devices. By law, we have to take into account the impact of policies, of applications, of any actions on both the users and the non-users. What's the likelihood that current users would stop using a product? What's the likelihood that never users would start using a product? And our job, even though you don't see this in the law, our job is really to assess the net population-level public health impacts of all of these actions as we are making our decisions. So with that by way of background about what FDA is doing today, now let's go back and take a look at what the industry thought about the true nature of their business and what they saw the true role of nicotine. And this starts in 1963 with a quote from the top lawyer for Brown & Williamson, which was then the third largest tobacco company in the United States. In 1963, a year before the first ever Surgeon General's report, the top lawyer for Brown & Williamson wrote that nicotine is addictive. We are then in the business of selling nicotine, an addictive drug. He didn't say that they were selling cigarettes or that that was their business. He didn't say that they were in the tobacco business. He said they were in the nicotine business. Philip Morris in 1972, the cigarette should be conceived not as a product but as a package. The product is nicotine. A pack is a storage container for a day's supply of nicotine. A cigarette is a dispenser for a dose unit of nicotine. And a puff of smoke is the vehicle of nicotine. Also in 1972, R.J. Reynolds wrote, "In a sense, the tobacco industry may be thought of as being a specialized, highly ritualized, and stylized segment of the pharmaceutical industry. Tobacco products uniquely contain and deliver nicotine, a potent drug with a variety of physiological effects." British American Tobacco in 1980, very short and sweet here. BAT should learn to look at itself as a drug company rather than as a tobacco company. And our last quote from a trade association that no longer exists, the Tobacco Institute in the United States. In 1980, they wrote, "The entire matter of addiction is the most potent weapon a prosecuting attorney can have in a lung cancer cigarette case. We can't defend continued smoking as free choice if the person was addicted." Very important to be able to look through the lens of what the tobacco companies were saying behind closed doors about the true nature of their business and the central role of nicotine. And they were thinking this and writing this a half a century ago or more. So now let's fast forward today to the public health reality, both globally and in the United States. In the entire 20th century, there were 100 million premature tobacco-related deaths in the world, primarily from cigarettes. The World Bank projects that for the current century, that is going to be 1 billion worldwide premature deaths from tobacco use. So that is the global public health reality that all of us in public health face when it comes to the leading preventable cause of disease and death basically everywhere. In the United States, we've made tremendous progress. From that first Surgeon General's report in 1964, when we had an adult smoking rate of over 40%, we're now down to an adult smoking rate of about 15%, so huge progress. Nonetheless, it's still the leading cause of preventable death. We now have a longer list of tobacco-related diseases based upon the 50th anniversary Surgeon General's report in 2014. So ironically, as consumption and prevalence are going down, the annual death toll from tobacco, primarily cigarettes, is going up because we have a longer list of tobacco-related diseases. And this figure is a conservative figure of 480,000 avoidable deaths in the United States each and every year, primarily from first-hand and second-hand exposure to cigarette smoke. And if you just do the simple math, from the time of that 50th anniversary Surgeon General's report in 2014 through mid-century, this is just in the United States, that's more than 17 million avoidable deaths from tobacco use. Most adult cigarette users in the United States are concerned about their health and want to quit. More than half of them make a quit attempt each year. Very few of them succeed. So we know that smokers are concerned about their health, and we know that they at least claim to be interested in trying to quit. What more can we do to help them? When it comes to kids, while the numbers on this slide represent progress compared to the heyday of Joe Camel in the United States in the late 1980s, it's a problem that nearly 2,500 kids light up a cigarette every day for the first time. And it's not just cigarettes. More boys in the United States light up a cigar every day for the first time than light up a cigarette. So we need to be looking at all tobacco products when it comes to kids. And the reality is that 90% of adult smokers in the United States started smoking when they were children and adolescents. So at FDA, and with the new commissioner that came on board, Dr. Scott Gottlieb, in May of this year, he sat down with us, he looked at our authorities, he looked at all these numbers, and he said, how can we make the greatest impact using the tools of product regulation? And he gave a very important speech 4 months ago, almost to the day. And he said, we truly find ourselves at a crossroads when it comes to efforts to reduce tobacco use. But if we're going to meaningfully improve the public health, we need to be willing to take a hard look at our entire approach. And I'll give you the details of what that approach consists of now. In what we call a new comprehensive regulatory plan aimed at both tobacco, but with a single-minded focus based upon those industry documents and those industry thoughts on the central role of nicotine. We're going to look at nicotine in cigarettes and the powerful form of addiction that comes from the presence of nicotine attached to smoke particles. In a more recent speech, the commissioner said, nicotine, while highly addictive, is delivered through products on a continuum of risk. And the combustible cigarette is where nicotine's delivery vehicle leads to incredible amounts of disease and death. That is an inescapable fact worldwide. In our comprehensive approach, what the commissioner announced in July is that we envision a world where cigarettes, they'll remain as dangerous as they are now. Every puff of smoke has 7,000 chemicals in it. But we're envisioning a world where cigarettes would no longer be capable of creating or sustaining addiction. And where those addicted adults who still need or want nicotine can get it from less harmful sources in that properly regulated marketplace that I described earlier. If we get this right, this will decrease the likelihood that future generations of kids will ever become addicted to cigarettes. It'll allow more addicted smokers to quit. It'll encourage innovation of the less harmful products for those who need them, and it'll support innovations for medicinal nicotine products, nicotine gum, nicotine patch, nicotine lozenge, and other therapeutic cessation aids. As I said, this new framework, this new approach, puts nicotine right in the middle, and the issue of addiction right in the middle. If cigarettes are the primary contributor to disease and death, and the problem with cigarettes is you become a regular smoker before you're even old enough to buy a pack of cigarettes in the United States. You're on that pathway to decades of smoking. Later in life, when you start to become ill, either cancer, lung disease, or heart disease, it's not the nicotine that directly causes those conditions. The nicotine got you addicted and kept you smoking, but it's the other toxic compounds in tobacco and cigarette smoke that are the direct causes of tobacco-related diseases, from cancer to lung disease to heart disease. So our focus is on nicotine and addiction. We acknowledge that there's this continuum of risk. You have combustible cigarettes at one end. NRT stands for nicotine replacement therapy, those over-the-counter medicinal nicotine products. That's the least harmful form of nicotine. Combustible cigarettes, the most harmful form. And all the other products that are the subject of so much discussion and so much debate worldwide, they belong somewhere along that continuum. We're not going to debate where to place smokeless tobacco or e-cigarettes or heat not burn, but combustible cigarettes and medicinal nicotine products are really the anchor points on this continuum of risk when we think what poses the greatest risk at the individual level, what poses the least risk. Our job as regulators in the United States is to strike the right balance between smart regulation and encouraging innovation and satisfying less harmful products, and that's what we're aiming to do, all based upon a strong regulatory and scientific foundation. We've announced a series of what we call advance notices of proposed rulemaking. We want the public to tell us what they think about issues like reducing nicotine levels in cigarettes to minimally or non-addictive levels, the role of flavors in tobacco products, the role that flavors play in enticing kids to start, the role that flavors may be playing with e-cigarettes, and helping currently addicted cigarette smokers successfully transition away from cigarettes. And we have the separate issue in the United States of cigars and the so-called premium cigars. We're going to be asking for comment on all of those issues. We're also going to try to create a sustained national dialogue on all of these issues and questions, on nicotine, on the continuum of risk, and on harm reduction. The Commissioner said on July 28th that envisioning a world where cigarettes would no longer create or sustain addiction and where adults who still need or want nicotine can get it from alternative and less harmful sources, that this needs to be the cornerstone of our efforts pursued with common ground. Each one of the things that we're working on fits into one of these quadrants. That product standard authority that I talked about, we're going to use it to reduce the addictiveness, the toxicity, and the appeal of products. We're going to issue implementing rules so that the industry understands the rules of the road for the various applications that they have to file with us. Apologies. I'm down in this quadrant here. We're going to look at the role of therapeutic products. Sorry. We're going to look at the role of therapeutic products, especially the performance of medicinal nicotine products, to see if these products can do a better job of helping more smokers quit, and in the lower left quadrant, encouraging innovation of less harmful and satisfying non-combustible products for those who still need or want their nicotine. We are committed to pursuing this comprehensive plan. As I said earlier when I was explaining the authorities, our job is to assess the net impact of what's going on at a population level. The net of all of the patterns of use is very important. If we get a whole bunch of currently addicted cigarette smokers to completely switch to non-combustible products, whether it's smokeless tobacco or e-cigarettes in a regulated marketplace, if we can get complete substitution, that's going to be good for public health. On the other hand, if the overwhelming majority of use of these non-combustible products is what we call dual use, where they continue to smoke cigarettes where they can light up a cigarette, and they use an e-cigarette or smokeless tobacco or some other product down the road, and along the way lose interest in quitting, well, then that goes on the negative side of the ledger. We don't have the answer to the so-called dual-use question. We don't know if it's a necessary transitional phase on a pathway towards becoming cigarette-free or not. We are vigilant in our concerns about the harmful effects that nicotine can play on the developing adolescent brain. No kid should be initiating on any nicotine-delivering product, whether it's a combustible product or not. But we think that this is an achievable vision, a world where kids can't become addicted to cigarettes and addicted adults have access to less harmful forms of nicotine and those improved medical products. That's what we're striving for, and we think that this is achievable. But it's only possible in a regulated marketplace where public health considerations and the relevant science serve as the foundation for science-driven, science-based oversight of the marketplace for tobacco and for other nicotine-containing products. Again, thank you very much for the invitation to come here. Happy to give this talk. Thanks.